Hello, I'm Steve Morris, CEO of Arthritis SA, and today is World Arthritis Day, and I'm really happy to be talking to Matthew Beard, who's a physiotherapist.
Thank you, Steve. It's a great opportunity on World Arthritis Day. I probably should introduce myself to all the consumers out there that I'm based as a physiotherapist in private. I work in a rheumatology clinic with a group of physicians, and then in the public sector I'm involved with a spinal service that's a statewide service. So I've probably got two aspects to my clinical life that may be of interest to all of you out there.
Yeah, no, thank you, Matthew, and thank you for agreeing to take part in this conversation. I think it's a really important conversation about exercise. Look, it seems from the calls we get to our telephone line and some of the evidence suggests there's real uncertainty about exercise, both its risks and its benefits for people with arthritis. So why is exercise important in the arthritis community?
Well, I'd probably view it for any aspects of the arthritis community as like a powerful pull. And could you imagine that there was a medication that in the long term had benefits on your both physical and mental health, may address joints, your muscles, your heart. For all those reasons, it's something that I think we all need to engage in and consider as a part of your total care rather than something that I'll think about later.
Yeah. So why do you think this is uncertainty from consumers about the benefits and the risks?
I think that's an important question, and it probably relates to a number of features. A lot of us see exercise from the aspect of an elite athlete or from what we see on TV and boot camp, and that all seems too hard and provocative. And on the other side, there's sort of those ongoing concerns that do exercise itself, is it dangerous to our joint health? And this is an area that's an enormous myth that we probably today need to explode.
Yeah.
And the way that we can explode is say there's been some wonderful research done recently where groups of patients with arthritis have been undergoing a regular exercise routine, and their joints have been scanned over time. And thankfully, there's been actually no change, no damage to the joint, no acceleration of any changes that we wouldn't expect. And for that alone, I think it gives us confidence that we need then to drill down the right exercise for the right patient at the right time.
Yeah. So there's a difference in the type of exercise, for example, broadly speaking, if you've got osteoarthritis or rheumatoid arthritis and the other forms of arthritis.
I think the differences need to be considered on an individual basis.
Okay.
And the two big questions that you should always ask, and I think one question is what are the benefits and risks of this approach, and the second question is how can I address my joint health, which is something we're talking about in World Arthritis Day, but the thing that often doesn't get talked about is our heart health.
Yeah.
And I'll probably lead into it, and it's a bit confronting, but from an arthritis point of view, if you have osteoarthritis, your risk of heart disease is about 25% more than the background population. If you have rheumatoid arthritis, sadly the risk is between 50 and 70%. Right. So it's something that, of course, there are a number of people involved in the care and management of that, but exercise is a big piece of the puzzle.
Yeah, and that's in the context of both, obviously, new drug therapies and surgery. So exercise still has a real place in terms of an intervention which can really help patients.
Yeah, I think that may be another problem because there have been some wonderful advances in biologic therapies for certain groups of patients with arthritis, and there have been some tremendous advances in regard to surgery. But if we looked at both those interventions and where does exercise fit on, there is no doubt from a surgical perspective, and we know, and there are plenty of studies to show this, that within reason, the fitter you are pre-operatively, the easier the journey is through the surgery. Yeah. And then you can't forget, of course, the rehabilitation post-operatively. So there are two pieces to the puzzle that are, one or other is often forgotten. If we put that aside then and think about the group of patients that, for a variety of reasons under the oversight of their GP or their physician, are on some of the newer style biologic therapies that for many have been a silver bullet. Yeah. Sadly, of course, often exercise is the poor cousin and gets forgotten about. But there have been some studies out of the UK that have shown that if you're on a biologic therapy and you have a regular exercise program, the benefits to your joint, physical and functional health are increased even further over those that decide just to be on the medication. So there are a number of areas you need to consider as a consumer, weighing up, as I said earlier, what are the benefits to me, not me, but you, and what are the risks?
Yeah, what are the risks? And so if you've been newly diagnosed with a form of arthritis and you're still uncertain about what exercise you should take, what would you suggest? What advice would you give?
I think the first thing that is so terribly important, Steve, is to dismiss the boot camp approach. And as I said at the beginning, if we consider exercise as like a powerful pill, and if it was your GP or your physician that was discussing the next steps in your management, when they write out a script for it, they're trying to get the right drug at the right dose and the right frequency.
Yeah.
Exactly the same analytical approach needs to be applied to exercise. Yeah. So whether we're considering your joint health or your heart health, what's the right exercise for you, Steve?
Yeah.
Not Miss Brown or Mr. Jones. What's the right dose and how often? And it's important to realise that most exercise routines, in some way, you have to do something most days of the week.
Yeah.
I think the best example I had, we don't clean our teeth once a week. You should be exercising really 7 days a week.
Yeah. So you're talking kind of about a customised approach for every individual, something that suits them specifically.
And that's critical. That I say about the script, it has to be a prescription that's for you. I always say the first step needs to be a very modest one. There's nothing more discouraging than flaring your symptoms if you go too hard too early. It needs to be monitored and reviewed over time, but it needs to be done in the context of something that interests you. And I'm not a great advocate of gyms, but some people like pools, and if that's the step one, please do it. I think it's also terribly, terribly important that you do it with something you enjoy and with a friend or a family member, because that will improve your compliance enormously. One other thing that will improve your compliance, Steve, if it happens to be walking, if you happen to own a dog, the likelihood of you sticking with the program increases by about 30%.
So the dog is the forcing function for exercise.
Well, it's something to consider. Dogs are great friends. They never have a bad day and they're always happy to see you. But they can also be great for your heart and joint health.
Yeah, that's fantastic. But I think it's really good that you kind of brought in the wider aspects, not just about joint health, but about heart health, which is really important. So just in terms of some final key messages for consumers, what we said is exercise really should be specific to you as an individual, but it won't damage your joints if done in the right way.
And that's the key. I think some of those myths of it being inappropriate or damaging, we need to explode them. In the same way, I would never advocate boot camp and aggressive exercise, but under the supervision of an appropriate trained clinician, taking that approach of writing you a plan that's right for you, monitoring the response, and you're probably the best advocate, you the individual, as to how you're going, over time progressing it, because you don't want to do the same thing indefinitely, and then making sure that, of course, at the end of it you have a goal. And I'd always hate, for me, a patient walking out of the door and say, well, I'm doing this, Matthew, because you said it was a good idea, but if you've got a goal to keep fit enough to enjoy taking the grandkids out, go for a trip, probably around your state rather than interstate now, get that caravan hooked up. They're all good reasons to exercise rather than exercise because I said it was a good idea.
Yeah, no, I understand. So there's one final message you want to give to consumers on World Arthritis Day?
I think on such an important day and a condition that affects such a great number of the community, both young and old, don't park it as a thought, I'll think about that tomorrow or next week. I think you need to engage, whether it's with your GP or whether it's with an allied health professional, tomorrow.
So take action now.
Yes. Let's not delay it for any longer, because the earlier you start, the quicker you're likely to get into a routine. And, if you think about goals that you want to be doing, not me, in 6 or 12 months
Yeah.
or 5 years, that's where exercise. You've got to think of the longer picture, the benefit to you, of course, as I said, at very, very low risk. But delaying it another day, I think, on World Arthritis Day is not the approach that I'd recommend.
Yeah. Thank you, Matthew. Thank you for your time. And I love the analogy around and your statement that exercise is a powerful pill. Something not to forget, I think. And look, just go to the Arthritis SA website if you want some further information about other resources in which we can help you. Okay, thank you.
Thank you, Steve.